This is Nikhil. Today we have the pleasure of speaking with Julie Blackburn, who had come in for treatment a couple months ago. And today we're going to talk to her about her experience, some of the issues that she found relief from because of stem cells, and just give a little bit of a sense of what people can expect when they come here for treatment. And we'll just go from there. So Julie, thanks again for joining us.
Of course, thank you.
So first off, I just wanted to ask if you could go ahead and introduce yourself to the audience.
I am Julie Blackburn. I have primary progressive multiple sclerosis, and I have been having issues with my mobility, which is the nature of the disease. Other options out there that you can't necessarily get in the United States involve decimating your immune system completely with chemotherapy and introducing the stem cells afterward. So this seemed like a good way to see if stem cells resonated with me at all and if I responded to them. So I found it to be a good option for that.
Okay. Could you talk a little bit more? You touched on it a little bit. Could you talk a little bit about the conditions you were experiencing, just the symptoms, what your quality of life was like, if you could touch on that a little bit?
Absolutely. When I was first diagnosed with primary progressive multiple sclerosis, I was 39. I had just birthed my second child. And interestingly, when you're pregnant, a lot of your symptoms are masked. Your body does funny things when you're carrying a child. However, I had been experiencing some symptoms, especially around my mobility, for a few years. And now I am 42. And when I was first diagnosed, they suggested that I just always walk with a walker, which was a pretty hard pill to swallow in your late 30s. However, I still managed to kind of shuffle around, and I still, to this day, walk with a cane and not a walker. But what affects me with PPMS is the right side of my body. So I would be sort of dragging and shuffling my right foot and leg is the primary issue there. Subsequently, symptomatically, when you're walking a little weird, you tend to get orthopedic issues. Think of it as I find that issues tend to move at 45-degree angles. If this ankle is sprained, this knee will start to go a little crazy because you're limping. Then this hip will start to go a little crazy. For me, the symptoms were going kind of horizontally just because of the nature of the way I was compensating for my odd gait. So it's sort of that drop foot, that knee hurts, now that hip hurts. Oh no, now you took a fall, you wrenched that shoulder. So I was also having orthopedic issues in concert with mobility issues by this neurological disease I was suffering from.
Oh, that must be very challenging. I can't even imagine.
Yeah.
So tell us a little bit more about the options you had tried for therapy. Maybe be curious to know if these are things you're still doing or if you phased them out. Just if you can talk a little bit about the routes you had tried to manage your condition.
Right. Primary progressive multiple sclerosis is a rare form. It's a rare disease within a rare disease. It's different. It doesn't so much attack your brain, it just attacks your spine. And a lot of the conventional methods that you may hear of people being on for multiple sclerosis, they're not an option for you. You have one, and it's Ocrevus. Ocrevus is an FDA approved, but it is what's called a black label drug. And I didn't even know what a black label drug was until I started taking it. But basically, a black label drug gets FDA approved, but they usually have 3 caveats that they could give you something that could be even worse than your disease, which is a stroke, a heart attack, or cancer. Ocrevus tends to lean towards cancer. They don't have that much data around it because it's fairly new, but it's sort of like, well, you could take Ocrevus and slow down the progression of PPMS, or just let it rip and become a prisoner in your own body sooner rather than later.
Wow.
So I chose to take Ocrevus. And I will say, even with stem cell therapy, I am choosing to remain on Ocrevus. For me, it just seemed like a good kind of 1-2 punch. The stem cells, after my treatment with them, I felt like I rewound the clock by about 18 months, which for me, for the progression of this disease, was absolutely miraculous. But it doesn't mean that the disease still won't progress. My immune system will still attack me. it still will chew away at those fibers. So it seemed like the Ocrevus still made sense to continue with. In addition to that, I was also getting Botox injections in my right leg to help with spasticity and the muscles fighting against one another as I was walking.
I'm always interested to hear what people say, you know, if they heard it from like a referral from a friend, or if they were doing research online.
I was researching online. I am a member of the MS Dream Center here in Rhode Island, and somebody there a few years ago had gone through an aggressive stem cell therapy where they also did a lot of chemo to reboot her immune system. She was in a wheelchair and now she's not. Now she walks. So I was like, I have to find a way to try something like this, to try some measure of this, to see if I respond to stem cells and give it a shot. Because even if it's 1,000,000 to 1, I want to be that one. And I needed to see that I exhausted every option to try to fight what's going on.
Gotcha.
So I Googled.
Gotcha.
Is the short answer.
Yeah.
I Googled.
Right,
yeah.
right. Can you tell us a little bit more in terms of the process from start to finish? I'm assuming you filled out a form and then someone contacted you.
I did fill out the form and I got a response from, I want to say like an intake coordinator. It was Deborah. And we had a few conversations and she talked about the statistics around MS patients. I did a lot of my own independent research too in regard to stem cell therapy, particularly around the fat cells, because I thought that was really interesting and different than just taking it from the bone marrow, that was also added as an option. And I did see that in rats that there was a really good cadence with stem cells around fat for neurological diseases. And I was like, hey, that's me. Let's try. Why not? In relation to the other staff, Billy, my nurse that I saw when I went there, I loved her so much. When I was done, I sent her flowers. She was phenomenal. I cannot speak highly enough about how cared for I felt with Billy in my corner. It really felt like she just went above and beyond and did everything possible to make sure that I felt safe in that environment. Dr. Rosenbaum did my procedure, all three of them. And I felt comfortable in that he told me, a lot about himself and his background. And I was happy that he was a plastic surgeon kind of in the past life. And I'm like, those are good surgeons. They do usually more residency than your typical surgeon. That's good. I like that. He obviously had experience and knew what he was doing. So I felt comfortable.
Was there anything specific that maybe tipped the scale for you in terms of, I'm sure you probably looked at other stem cell therapy centers. Maybe if you can talk a little bit about that, like if there was anything specifically about the company, about maybe the research, the work around the world, maybe if you can talk a little bit about that.
I just felt right with, in the confidence and conversations I had with the intake coordinator, Deborah, and Billy, the nurse. I just felt it was the right place to get it done.
I'm really glad to hear about your experience with Billy. She's great.
I think Billy is an exceptional nurse in that she genuinely cares. A lot of people, they have to turn off a switch mentally just to protect their own mental load and treat you as meat. Billy does not do that. I will say, just from my own experience, I don't tolerate also-rans when it comes to my medical staff. I can't. You have to act as your own advocate when you have a disease like mine, and I don't tolerate anything but the best. And that's just the way I run. So, yeah.
How about Deborah? Was there, in terms of your interactions with Deborah, was there anything that stood out in terms of how she walked you through the process or answered any questions? Her level of knowledge about stem cells, was there anything you wanted to touch on with that?
Deborah is a good person for communication, that she can really relay what you need to know through the phone. And being that I always needed additional information just from being a data scientist, just from really poking the bear that way, she was always good at responding to me very promptly and thoroughly through email as well.
We do get a lot of patients from out of town, and I think they're always interested in sort of knowing the procedure from start to finish, because like I said, usually when you think of going to a doctor's office, it's just, driving 15, 20 minutes, getting your treatment, coming back. Here, it's obviously, you had to fly in, you had to get a hotel, I'm assuming, and et cetera. So can you walk us through a little bit about that whole experience, about from flying in to flying back. If you can talk a little bit about that experience.
Absolutely. This is another point where Deborah really shined in that she told you, this is where you should fly into. You can stay at this hotel. You can get a discount. Tell them about us, kind of a thing. And that really, so I knew exactly where I was going to stay. I knew where I was going to fly in. I flew out with my husband. We flew out from TF Green Airport. That's right in Rhode Island. Nice direct flight to Chicago O'Hare. And we did rent a car when we got there because we weren't too sure with the pandemic and everything, if you wanted to Uber or whatnot, and will they be on time to get you to your appointment? So we did choose to rent a car. And we went to the facility, and oh boy, I hope I can remember the timing. Basically, I did all 3 procedures in 1 week. So it was something like you landed on a Sunday, the first was the Monday, rested Tuesday, had the next procedure Wednesday, rested Thursday, had the 3rd procedure Friday, and flew out Saturday morning is how I did it, which was a little aggressive, but I have 2 toddlers at home that were desperate for me to be back. And sure. I will say the progress was really phenomenal in that we wanted to save my energy when we first stepped to TF Green Airport. So he pushed me through the airport in a wheelchair because airports can be pretty big. O'Hare is much bigger than our little Rhodey airport. But on the way out, I was pushed in a wheelchair because I was recovering still, also from a couple surgeries, minor. But when I landed in TF Green, I walked out of that airport with my cane, but I walked out. And as I'm walking, I'm just like, this is phenomenal. And I had tears in my eyes. It's like, how are we not funding this? This works.
Absolutely. Can you tell us a little bit more about sort of the facilities? Obviously, there's the procedure room. I think people are always interested, and you can speak to this a little bit more about the recovery room, just kind of after you get the bone marrow extraction, kind of how is the facility, and maybe I'd love to hear your thoughts on the recovery room and sort of how the staff sort of treated you during the procedure with, I don't know if they brought refreshments or lunch or anything. If you can maybe talk about the whole experience within the office.
Sure. The recovery room it's very nice. There are 2 large rooms for my husband to sit to. They brought us both brunch. It was pretty tasty. They give you some oxygen therapy in addition to, your stem cells dripping back into you. And they have a nice big screen TV that they had all rigged up with Netflix. So my husband and I watched the Great British Bake Off as we enjoyed our brunch, and it was nice. Yeah.
How was it in terms of pain? Because I know people hear about bone marrow aspiration and drilling into bone, and they sort of alarm bells ring off.
I didn't think it was that bad. I will say, I'll walk through the 3 procedures. The first procedure, you can definitely feel pressure. However, my expectations of exactly what was going to happen. He talked about the injection first to numb the area. He talked about the pressure. He talked about the tapping of the hammer. And he talked about the sensation you'd feel when they were aspirating the bone marrow out. So there wasn't any surprise. So that procedure went very, very well. And when I left, I was completely shocked that there was no pain. And I mean no pain. Just maybe a little tenderness, like a bruise that you would take OTC Tylenol for. The 3rd procedure, which is just glorified lipo, that was uncomfortable toward the end of it, or again, I don't know how long the agents last. And they have you wear like a binder afterwards, but it's not too bad. I had him write a prescription just in case. It became overwhelming because abdominal surgery, as somebody who's had 2 C-sections, is a pretty big deal. And I've been through that before. However, even though I had him write the prescription and I filled it just in case I wanted to stay ahead of it, I never took it because I didn't need to. The pain wasn't that bad. With that binder and having a lipo, or somebody who had never had lipo, if you stand up without that binder, it feels kind of like your guts are going to fall out. So definitely wear the binder.
How do you feel the stem cell therapy has provided benefit to your overall condition?
Absolutely. I wanted some database evidence on what the improvements actually were. So I had some appointments queued up. Everybody knew, all my doctors knew that I was getting stem cell therapy. So I have a doctor of physical therapy, and she measured me on the 6-minute walking test and everything. And she saw some improvements with everything she measured me with. But the biggest one that she saw was in drop foot. Something called drop foot is when your foot actually drops. I'll kind of show you with my hand and you can't control it. So that's basically ranked on a scale of 0 to 5. 0 is your normal, 5 is we have a major problem. My ranking was a 2. Pursuant to stem cell therapy, my ranking was a 1, which for me was phenomenal and made a big difference. Additionally to that, I saw my doctor who did my Botox injections in my right leg to stop that spasticity and the muscles fighting against each other. The physical therapist and that doctor saw that the spasticity was virtually gone, to the point where I am seeing that doctor again in early March, and she doesn't think that we will possibly proceed with Botox in my leg again, which is wonderful. One less thing to take. And I had this semi-natural, it was my own stem cells back into me. I found that my mobility has improved significantly based off of those small but immeasurable gains for me. And I wear a Fitbit, and I've been taking more steps every day. Many days, and I have a pretty sedentary job as a data scientist. I'm at the computer, but there were days where I was doing something like 1,500 to 2,000 steps a day. Now I'm surpassing 5,000. And that for me is huge, absolutely huge. And in addition to all of that, a lot of my orthopedic issues, which I never even thought about. When you have MS, orthopedic aches and pains, that's nothing. You don't have time to worry about that. But my knee, hip, and shoulder had been hurting me from the funky gait and a fall. All of that pain, knee pain, gone. Hip pain, gone. Shoulder pain, gone. So that made it so I was able to push the boundary doing my physical therapy more than before and get some really nice gains that way too. I feel just so much better in that I can get around a little bit more. Having mobility issues is so isolating. I mean, the pandemic makes life isolating too, but it can just really kind of put you on the other side of the road. Yeah, but I'm excited with the gains. I really am. As I said before, for me, rewinding the clock by about 18 months, that made the price worth it. It absolutely made it worth it. It took the pressure off my mental load of, is there something that I could do to fight this disease that I haven't done that could work? You know, I got to take that off my mental load that stem cells could actually be working for me. That could be a potential avenue for me. And that meant a lot. It really did. I was hoping when I went in that I would get about a 5% tune-up. That was my hope. And I'd say I got more of like a 10% tune-up, which people don't realize, you know, that is completely worth it. I would do this every couple of years if I saw my progress slip away. I honestly and truly would.
Yeah. No, I'm glad to hear, 10% is pretty considerable, being a data guy myself. That's not that is statistically significant, as they say, right?
Statistically significant, yeah.
Is that the term? I don't know what the p-value is, but
yeah.
Can you talk a little bit about the general feedback you got from friends and family about your post-procedure condition? Like what were they observing?
They were really amazed. My mother was particularly amazed because she was just so very, very hopeful, and I was trying to keep her expectations very low, as were mine. But just the way I was walking, and then she was on the phone gushing to my sister, like, she's not walking weird anymore. It's like, I walked weird? And just the way that normally in the house when I'm walking around, I kind of furniture surf like a toddler for the balance. And I haven't really been doing that anymore. And that was something that everybody around me who lives with me noticed right away. My husband, my mother.
Can you tell us a little bit about sort of your treatment regimen after getting stem cells? Was there any medication you were able to cut down? Were there any other adjustments you were able to make?
The only major adjustment I made in my treatment regimen, which still remains to be seen a little bit, is I'm probably dropping the Botox from my right calf. which I will be glad not to get a needle in my right calf anymore. So the most significant medication that I was able to change was potentially dropping the Botox from my right calf because the spasticity was so greatly reduced. The Ocrevus, it just makes sense to stay on that because it's the most potent medication I can stay on to fight a neurological disease. I wasn't somebody who necessarily took NSAIDs or anti-inflammatories for the orthopedic issues I was having. However, boy, I really just feel so much change in the pain levels after having the stem cells from those orthopedic issues, the knee, the hip, the shoulder. I can't believe how much that was taking up a mental space when you're trying to walk and already have mobility issues. It's like, oh, and now that I'm pain-free, I can actually correct my gait a little bit, which is huge.
In terms of your views on stem cell therapy, like how did your views change following your treatment? And maybe I'd like to know kind of what your future plans are. You had kind of alluded to this earlier. You'd said that you were considering, maybe getting a treatment in another year. Maybe you can talk a little bit about that.
I have heard of people in the past with MS doing treatments similar to this, where they're basically getting a tune-up every few years. I could see that as being a possibility for me as well, especially if I see the gains eventually starting to degrade. My disease is progressive. It's not going to stop. So we do our best to delay things and slow things down and kind of kick that can as far down the road as possible. If it was affordable for me and I could, get the same benefits, I would probably try to have it done again within 2 to 5 years.
What would you tell anyone who's thinking about getting stem cells?
When you have a chronic illness or something that is pushing you to the length where you are actually looking at stem cell therapy, how to act as your own advocate. You have to. So I would say just do your research, and if it makes sense, take that plunge. I talked to a lot of my friends at the Dream Center, and I did recommend, hey, if you want to see if this is a shot for you, this is a way of getting it done without the aggression of chemotherapy in concert with it. And that way you can see if you respond to stem cells at all. I think that for an outpatient facility, they really got the job done. I would manage their expectations that it is an outpatient facility. They never had any illusions over the phone with me that it was a hospital. I knew exactly what I was walking into. It was exactly what I expected. But I think some people are expecting, something like Iron Man level of visual.
The Mayo Clinic or
exactly.
Mayo Clinic,
and it's not that. It's an outpatient facility. That's why the cost is so low. Let's not be fools here. But yeah, no, it gets the job done. It was an outpatient facility. It was neat and clean. And what more can you ask for?
On a scale of 1 to 10, how would you rate the medical staff?
I would give them a 9.
Okay. So in terms of the logistics and the booking process from start to finish, on a scale of 1 to 10, how would you rank that?
10. It was efficient. She did a great job, as I said before, just managing my expectations of this is the airport you're flying into, this is the hotel that you should stay at, this is the discount for staying there. So that was great that way. And of course, the hotel does a decent job of telling you where you can eat or who delivers. I mean, I did not leave to dine out. It was a pandemic and I was recovering from minor surgery, so I stayed in. So yeah, no, I thought that deserved a 10. I knew exactly what to expect.
Okay. How about the facilities as a whole?
I thought the procedure room to recovery room and the whole office looked very good for an outpatient facility. There was a nice reception area. There were some comfortable couches to sit on while you were filling out documentation. The staff came out to that area, the nurse, the doctor himself, talked to you for a few moments, made sure you feel comfortable and knew exactly what to expect with the procedure. There was a little room where you went to change into scrubs, or not scrubs, a gown, and and basically go into the procedure room from there. Then you go to a recovery room.
In terms of the results you're feeling right now?
For orthopedic improvements, I would give it a 10. For just pain relief and having just lubrication in my joints again from actually being able to move. That's going to be a 10. For MS specifics, because that is such a crazy, cruel, weirdo disease that they don't know much what to do with. And for my rare disease within a disease, for PPMS, I'll give it like a 5 or a 6, in that obviously there is no cure for PPMS. There is no cure. But when the best you have is delaying progress, and I actually got to rewind the clock a little bit, I have to give that positive thing. We'll say something that surprised me that I wasn't expecting was just how great the anti-inflammatory process was for the whole thing. I couldn't believe, I was absolutely amazed at orthopedically how great my joints felt. My hip was like clicking on every step, and now it's just moving beautifully. I actually lost my wedding band because my wedding rings just slipped right off my finger. I kept the rock, thank goodness. I found that, but the wedding band rolled down a little bit. But I was so happy because it's like, let's face it, Julie's 20 pounds heavier than when she got married, and it's just slipping off my finger because my knuckles are even not inflamed anymore. Incredible. So that's a nice little piece of evidence. It's like, whoop, look, it's gone. It just slips right off where it was tight before. Who knew? Yeah.
Do the ring test. That should be the new...
The ring test, right? I couldn't believe it. Yeah, I'm wearing a little fake one right now that's fresh, but look how it just pops right off. Normally to get your wedding ring off, you're kind of wrenching it around. Nothing. So I got to get it downsized, I guess, or get some sizing beads. Who knew? Yeah. But yeah, no, I used to like not be able to put a coat on without going, because my shoulder was all messed up, and now I'm like, wee, you see me. I'm fine.